Muy buenos días a
Good
todos.
day, everyone.
Gracias por conectarse
Thank you so much for joining on this first conversation.
Vamos a dar un minutito.
We're going to give one more minute.
Muchas gracias por estar aquí.
Thank you very much for joining us, for your interest in this topic.
Les damos la bienvenida.
We would like to welcome you to this series of webinars that we are starting today from Alianza Americas called Fraud's Vulnerabilities and Approach to Climate Change and Forced Displacement in Mexico and Central America. With this effort, we would like to call your attention to the realities of the people that are living there in condition of disability. So we will listen to experience of the people that are most vulnerable. But the vulnerabilities to climate change and enforced displacement aren't a structured ensemble of consideration. This series of virtual seminars aims to understand, identify the differences and realities of people living with disability, living with in vulnerability, and how risks are increased due to climate change, climate crisis and displacements. We aim with these webinars so that this is a resource and an invitation to recognize the impact of climate change, crisis, and displacement in the lives of all individuals, highlighting the impact on people that are living in more vulnerable conditions. I'd like to invite you to be on the lookout of the next dates of these events that we'll have. And I would like to give the floor to Michelle Garcia from Access Living. Over to you, Michelle. Thank you very much, Hazel. Thank you very much for having me here today and allowing me to moderate this conversation and these series of webinars on this topic. I am Michelle Garcia. I'm from Access Living. I am the director of grassroots community organizations and Access Living, and I support the community organizations in health, migration, and also housing. And this, I've been working with Access Living for 16 years, and with the work that we do, I have seen much vulnerability. We also work in the area of a climate crisis, both at a personal level as well as with the work that we've done. We've seen how this has an impact on us. That is why that I'm thankful to be here today. So, as I said, it's a pleasure to welcome you to this first conversation in the series of webinars called Vulnerabilities, Cross Vulnerabilities, and the approach for climate and forced displacement in Mexico and Central America. My name is Michelle Garcia. I am a member. Access Living is I'm organization that is member of Alianza Americas. I'm going to start off by giving you an announcement that we have interpretation available. I would like to remind you that this event will take place in Spanish with interpretation to English. So you'll be able to enable this option at the bottom corner of your screen on Zoom. Please take a minute to locate the option, and in case we have questions with interpretation or you may need assistance. I hope it's working for everyone. All right, so now I'm going to share this in English. So for those who need interpretation.
Interpretation into English. You may enable this feature on the bottom right corner of your Zoom screen. Presentando a la panelista.
I would like to introduce first our panelist, Jenny Chinchilla. She is a psychologist from El Salvador. She specializes in inclusion of people living with disabilities, rights of women, gender violence preventions, and other areas of social development with perspective of gender and disability. Jenny has been a consultant for
Humanity,
Wheels for Humanity, which is a population fund of the United Nations, Mo- Mobility International USA, among other organizations. She's currently the project coordinator for the foundation Sendas. And we would like to thank Jenny that she is here with us today to shed light on the priorities and the protection of people living with disabilities in the context of climate change and forced displacement. We would also like to invite the audience to ask your questions or your comments in the Q&A section. Since we will be having a session at the end to answer said questions. So questions, I will be reading a question and I will give the floor to the answer so that Jenny, our panelist, can answer them. So I'm going to ask the first question and she will have a few minutes to answer said questions. May we start with the first question to Jenny. So welcome, Jenny. So the first question for Jenny is, which are some of the main risks that are faced by people living with disability due to climate change? Well, thank you very much. First and foremost, I would like to thank Alianza Américas for your invitation to Fundación Senda so that we are able to participate as panelists in this space. As I have already been introduced, I am the project coordinator in Fundación Sendas. Regarding this question, and also, I would also like to thank those that have joined us, those that have registered. There was a lot of interest this week from people living with disabilities and that were interested in knowing about this topic. In regards to the question of what are those same main risks that are faced by people living with disabilities due to climate change, I would like to first of all to define so that it's clear for everyone what is disability and who are those that are living with disabilities, because maybe the question may bring us to sort of what are those barriers or risk may not be the same for the rest of the people. Would be the question. They are not the same because people living with disabilities, not due to our situation of disability as such, we are facing more risks, but it's due to the barriers that we face. The Convention on the Rights of People Living with Disability defines us as an approach of human rights that we could understand as disability and who are those people that are living with a disability. In that regard, it defines that disability is a concept, meaning it's not the individual, it's a concept that evolves. Disability is a word that has been presented multiple variation and it has evolved through time. Today, we understand that this concept is related to the individual with any characteristics, whether it's physical, physiological, may they not be able to walk or to see, listen, hear, but that characteristics or deficiency. Looking at it from a medical perspective, when we interact with the barriers in our environment, whether these barriers are physical in communication, access to services and products, as well as the attitudes of discrimination that oftentimes we find in the systems, from the state, in the society, all of that merges, and it is known as disability, meaning that I, as an individual, I'm a wheelchair user. I don't have a disability. Well, I'm not in a position of disability just for the fact that I can't walk, but it's because the environment isn't friendly or accessible for me to be able to do life in the same conditions as others or able people. If we mobilize this concept to say something to the context of climate change and all of the risks that this brings forth, so we find ourselves with higher risks. One of them is the lack of information that is accessible to know about early alerts. We have had in El Salvador for 2 weeks a national emergency, 3 weeks almost. During this national emergency, there were press conferences from the governing entities regarding environment and civil protection, and there wasn't sign language interpretation, so that those people that were deaf were able to access information in the same conditions, and that way we can number a series of barriers and risks that we may find the West persons living with disability added to the places that we live in. It's not the same thing for a person that can flee and running in the face of an emergency, landslide, or that is the case of a person that is a wheelchair user, a person that is blind, a person that is deaf, that doesn't have the same access to information. It's important to first define what is disability, who are the people living with disability, and now we have a larger framework on why we are facing more risk. Thank you very much for this answer. And also, thank you for broadening this landscape, let's say. Second question would be, what are the main barriers that people living with disabilities face in access to medical services during situations of emergency, such as disaster, climate crisis-induced disasters? Yes, we were already mentioning it. Those barriers that we face may not be only during the situations of crisis or risk, disaster due to climate change, but it's also a continuum of all a thing that is on the daily lives throughout our lives in the different age groups of people living with disabilities. Ever since we're born or we acquire a situation at the physical, at a psychosocial that brings us to live in a condition of disability, from that moment, we are facing multiple barriers, not only in when it comes to the medical environment, but also other areas in society. And I may go a little bit beyond that. It's women living with disabilities, those that have faced most barriers. We know that in our country, in Latin America, in all countries in Latin America, there is still those conducts that are misogynistic, that are discriminatory against women in general, and for women living with disabilities, these are even bigger. In that sense, in the medical facilities, since there isn't a ramp to access for people that are wheelchair users, or that we don't have the medical staff that is trained on how to treat a person living with disability. We're not talking about special treatment. We don't want special treatment. But how can we interact in terms of accessibility, not using pejorative language or negative language, not re-victimizing the person living with disability? An example is for when a woman goes to a consultation with a physician. This isn't a topic, but it does apply to it. She may be going to a consultation with a physician because she is pregnant. One of the things that may be said by the medical staff is that, don't you love yourself? Why don't you take care of yourself? Isn't it enough for you as a person living with disability having to fight for your own life, and now you want to bring another child to this world? Those words, that pejorative language, discriminatory language, sometimes with even mocking tones towards the person with disability. And sometimes it's not so much that they are mocking, but it's a lack of knowledge. We're not only talking about barriers, physical, that are tangible in the medical environments, but we're also talking about those barriers about knowledge or lack of knowledge from the medical staff that they just don't have when it comes to providing care or interacting with a person living with disability. Let's say that in these spaces or in these situations of crisis, there we also need to provide care for mental health. It would be good and interesting to ask ourselves, how many professionals in psychology know can use Salvadorian sign language to tend to a deaf person in crisis? What type of service will they provide? All of these things bring us to think it's not only about environments that are physical, about facilities that are physical, but that are accessible, but access to information from the moment that the person enters that medical facility or center, during the attention, and during the follow-up. Thank you very much, Jenny. I think you've mentioned some very important points. Myself, as a person living with disability, as a woman living with disability, I have gone through many situations that you have mentioned, and I agree. The fact that physicians think that they know better than us or more than us, or they want to sort of diminish the fact that we don't know our own bodies, our own capabilities, and that they think that they know what's best for us, and that we don't understand what they're saying to us in regards to medical health. That is something that is always we've always had to face, and that barrier when it comes to medical services. So I think that that is really important when it comes to women be going to a hospital. They've said so many things to me, but you can't have children. Why would you would you like to do a checkup in that regard? Who says that I don't want to have children just because I have a disability? Yes, and you know what, Michelle? Oftentimes, the medical staff and society in general doesn't look to get trained to get empowered on the topic, or maybe they receive training with other sources that may be good, but they don't include people living with disabilities. So it's good, and we do this call here to the medical staff, to professionals in different professional areas that provide services, public services, in a community, to get trained, and to also look for those organizations of people living with disabilities so that they can get trained by them to generate programs and training processes where also we include they hire facilitators, the people living with disabilities, how to interact with people with disabilities, and also that it can learn Salvadorian Sign Language, because it's a duty. The Convention on the Rights of People with Disabilities makes a call to those individuals and professionals that provide care to become empowered, to become trained in how to interact with people living with disabilities. Exactly. Thank you very much. I will continue with the following questions because I know that we have many. So, how can shelters and emergency centers improve their facilities and services to properly provide care to the needs of people living with disabilities, particularly in terms of accessibility and medical resources? We've already talked a little bit about this, but maybe we can go a little bit deeper into it. Yeah, we've discussed it a bit. The first thing would be training. Training at a professional level. It's not only that, yeah, you're gonna read a leaflet on how to interact with a person living with disability. No, this is a training process. The medical staff and other professionals in different areas can't even imagine the ocean of possibilities for their professional and personal growth that they refuse to access to when they don't give importance to training. They can't imagine that this may open more doors to them, because when people living with disabilities and organizations, we execute a project, and maybe we want to have allies for our conferences, our projects, our panels. We identify professionals, the people living with disabilities that have knowledge on the topic of disability, that have a level of professionalism. So we go back to this. It's important for professionals get trained and they take it seriously. For example, this webinar is part of a training process, starting to getting to know from the experience of people living with disabilities. The other thing is that we should know the legal framework. Knowing the legal framework that we have in El Salvador is really important. Everything that we've discussed, what I'm mentioning, it isn't something that we've invented because this came from just because it's just from our experiences. This is sustained by experiences throughout time and also documented in research. And also, El Salvador has legislation that is rich regarding disability. We have regulations on accessibility that give the parameters so that both environments, physical, architectural, transportation, telecommunications are accessible. We have inclusive education policies. We even have the Salvadorian state has ratified, has signed, made part of his legislation, the Convention on the Rights of People with Disabilities, the Inter-American Convention against all ways of discrimination towards people living with disability. We have other agreements that in a cross-cutting way may allocate some articles to focus on people living with disability. So there's richness in our legislation, but it's unknown, it's not practiced. I find it interesting that in El Salvador sometimes we continue to build facilities or make modifications to buildings, and these regulations and accessibility are forgotten or ignored. There was a recent building that was just inaugurated, and there was also actually there was still we needed ramps. There were ramps that had stairs, bathrooms with narrow doors. Where for example, my wheelchair is small, I can barely fit in. It doesn't have the proper measures. So I would tell the person that was showing the place, this place needs a lot of accessibility. Yes, where can we get information on that? So that the architects can make modifications. We don't know. Or is it something that we need to look internationally? No. There are regulations for physical environments that have been approved by the er, by the regulating entity in El Salvador and also by the regulating entity in disability, which is the Council of Attention to People Living with Disability. These are legal instruments and policies that already exist in our country. You don't have to look elsewhere. It is already present in the country. So this is what it means when we say empowerment. Because if you don't know the law, how are you going to put it into practice? How are you going to consult it to create environments and services and products that are accessible? Thank you. You make me think of, for example, here where I am in the United States. But here they also have the law of Americans with disabilities, but it's going we're going to reach on July 26th, it's going to be 34 years since that law came into force, and there are many places where this law isn't enforced. And as you say, there are establishments or facilities that are being built, and we are still fighting with the fact that they comply to with the accessibility regulations, whether it's housing or public spaces. It's unbelievable to say, oh yeah, we didn't know, we didn't. But you say, but this law has been present for 34 years. How is it that you're not going to know about it? And you know what's curious? That many of these individuals that work in these public entities or private entities, they are specialists in disability, and that is the position that they've given them to respond to projects, areas, or departments, and they don't know anything about disability. So exactly, and it's not discriminating against it, but it's making a gall to them because they may be in these positions, and with more reason, that should give that urgent importance and immediate importance to get empowered to play this role and provide and also provide the service as it should be. That's correct. Thank you very much. And I'm so happy to hear that in El Salvador we have these laws that have been established, because we know that in other countries these types of regulations haven't yet been established, and we need to continue struggling for them to exist. So thank you very much for providing this information. We will continue with the questions now, and they may be a bit repetitive, but it's good to add elements to the conversation so that we continue to educate ourselves. What are those best practices in regards to creating accessible communications that are also equitable for people living with disabilities in the face of risk and particular barriers that are faced in these situations? Well, one of the best practices that we consider is those that bring forth our slogan, nothing about people with disabilities without people living with disabilities. Meaning that all actions, all projects, all implementation of a program in a country, in a community, needs to be implemented, whether it's a local or international organization, whether it's corporate sector, public entities. It may be beautiful to have an intention to help people with disabilities, etc. But if we continue to position the person with disability as a simple spectator, as a simple beneficiary, we aren't doing much because we are not breaking through those traditional paradigms of making small things with people living with disabilities we can support them and we need to help them. No, the approach of human rights today demands that all actions bring forth the full and effective participation and equal opportunities for the people living with disabilities, meaning that we participate in the design, research, implementation, execution, and follow up and monitoring of projects and programs with our active participation. Maybe us as a foundation, as Sendas, as organization living with disabilities, we have really good examples of good practices with organizations, international entities. We can mention the Population Fund of the United Nations, a country, some of them have done empowerment actions on the topics of sexual and reproductive health, violence prevention, and also with the Green Global Fund and momentum for many entities such as USAID, where we are implementing projects to reduce risk disaster risk reduction, where we have been included as people living with disabilities, and through our organization, calling other organizations from civil society in our country so that we can participate actively, no longer as spectators, but as the main characters. And now, with you, with Alianza America, we aren't talking about the topic without a person with disability, but you have respected the fact of inviting a panelist. There's a person living with disability, whether it's me or someone else. And this gives great value. It adds to the approach, to the human rights center approach. Thank you very much. I think indeed it is really important. We're really thankful as Accessing and the Alianza Americas has also, because we're part of Alianza Americas for many years, and we've been part of this work that has been done not only with Alianza Americas, but also with these webinars and this type of work that we're doing together. Added to this question, I would like to know if you could maybe give us a few examples or experiences, mentioning some concrete experiences of people living with disabilities and these decision-making spaces that are linked to climate change. Certainly. Actually, with Fundación Sendas at this moment, we have a beautiful project called Impact of Climate Change and Participation of Women Living with Disabilities in this contingency strategies for risk reduction and disasters. The project looks at two important points. First one is, how does climate change impact the health of people in general, but specifically we have focused on the impact on women living with disabilities. Someone could say, I think the climate change is this heat that was ever has an impact on everyone equally. That's not the case. People that are wheelchair users, being sitting down for a long period of time in our wheelchairs, most of them may have cushions or may have steel materials. These materials get overheated due to the high temperatures that we have had in during this year specifically. And then there are people that have orthopedic devices or implants of aluminum within them because but they have fractures, but there's a lot of cold. This also affects them. People that are blind that may use glasses to cover their due to the impact of the sun, even though they may not see, the eye and its own the eye socket perceives heat. So this extreme heat that we have been having do have an effect. The fact that we need to touch the wheelchair to maneuver it, and also the walking device. Those that have severe disability that have little mobility and they use maybe Pampers or diapers, being using it because they may provoke uh, issues with their skin. This is a physical, but all people, I think I won't be mistaken here that the, the heat really irritates us. It puts us in a bad mood. Maybe we're sweating but that issue is multiplied due to our state of so mental health has also been affected in people living with disabilities. Those that are already have to remain for a long time at home due to lack of employment, not having an activity that may occupy their time, and also having to deal with the weather, extreme weather, and the conditions. This tends to further complicate the deterioration of mental health. So, the project that we are executing with Fundación Senda, thanks to the Global Fund, is exactly that, empowering women living with disabilities so that we recognize what are those effects in our health. But that isn't only it doesn't mean only identifying them, but also identifying how women living with disabilities, we can also make proposals to those entities that are in charge and of risk management, those strategies that will include us in the plans at a municipal level of risk management, because it's climate change is a reality. And let me tell you, now the concept has changed from climate change to climate crisis. Last week, I was in the fifth conference of population and development that took place in Cartagena, Indias, Colombia. And one of the topics that was highlighted was that all of the policies and development programs should include the economic recovery in the face of not climate change, but in the face of the climate crisis, because the whole planet is facing a climate crisis that is affecting disproportionately the sectors of the population that are most vulnerable. Among these, for the reasons I've already explained, the same people with living with disabilities, and within these groups, in multiple ways to women living with disabilities. So, in the project, we are identifying what are those strategies that the states need to take into consideration. We will be producing material, audiovisual materials with messages from people living with disabilities and calls to attention to society to not throw away trash when they shouldn't do so, to plant more trees. So, positioning women with disabilities, live with disabilities, but not as spectators, but we can also give significant additions to the crisis that we're experiencing. Thank you very much, Jenny. Thank you for adding to this topic. It's a pleasure. It's happy to know that you're promoting among women in the community so that they can make support the efforts in this to mitigate this climate crisis. I was sharing with a colleague from Las Americas, at least here in Chicago, climate change all the time. It's snow one day, sun the other. Climate changes. I am a wheelchair user, and due to my disability, and because I'm in a wheelchair every day, my blood circulation isn't good. I'm cold. I'm hot. The wheelchair is also complicated because snow doesn't allow you to move around. It also has a big thing not only physically but also mentally. And you say, well, I feel like this because I can't go out. I feel like this. Okay, I feel good. So everything plays a role, affects your climate change. The fact that the COVID crisis also had an impact, an important impact. We've seen that the community of people living with disability was impacted further since COVID hit because sadly, this had an impact on our community even more, and not in a good way either. And actually, it also brought some situations that we needed to amplify our ways to cohabitate with our disability, working from home through Zoom, etc. So it changed our lives definitely. So okay, let's continue. Thank you very much again. Next question is, what measures can governments and non-governmental organizations could take to guarantee that the people living with disabilities are included in the response plans and recovery in the face of disasters, and that they receive an attention that is equitable and efficient? As we mentioned previously, including the people with disability not only as beneficiaries, but also as individuals that can make significant additions. And here I would like to specify to mention what the Convention on the Rights of People with Disabilities states, which is let's say something that is really interesting in their literal M. And this, when you read with knowledge and you find that flavor to that mandate that we have in that convention and that awareness raising, not only of reading it, but also putting it into practice, it's when you say, there's so much work to still be done. The convention says, recognizing the value of the contributions made and could be done by people living with disability to general well-being and the diversity of their communities and the promotion of full enjoyment of human rights and essential liberties for people living with disabilities and their full participation will have as a result more but more sense of belonging by these individuals and significant progress in economic, social, and human development in society. Considering that people living with disabilities shall have the opportunity to participate actively in the processes of adoption and decisions on policies and programs that are including those that may affect them directly. That is the mandate that the convention stipulates in the face of any decision to adopt on policies, programs, laws, not leave behind those people living with disabilities. And in the face of the situation of climate change, which also the convention says that the development and application of programs of education and awareness raising of the audience, general public on climate change and its effects, access to the people to information on its effects, participation of people in the study of climate change and its effects, and the development of a proper, adequate response and preparation and exchange of materials, educational materials dedicated to raise awareness among people. It won't only be done by experts in risk management. We are also including the public, meaning a population, and within a population, we shouldn't leave anyone behind as it is stipulated by the Sustainable Development Goals. But we people with disabilities have always been left behind. It's the time to no longer leave us behind because we have great additions to provide, great support to provide. Also, Mami Miss Tori, who is the special representative of the General Secretary of the Risk Disaster Mitigation, makes a call so that in the growing gravity and frequency of disasters related to climate, it's an issue of survival for those most vulnerable countries to climate. On the other hand, in an interview, she declares that it's necessary for there to be a positioning of women in the global agenda, a climate global agenda. Besides of placing them as leaders in gender equality and their knowledge and empowerment may add value to the global surge of global disaster reduction. This is the best call that we have. The governments and international agencies from United Nations in their local offices, as well as the private sector and other civil society organizations, shall include people living with disabilities by giving them leadership, also to women living with disabilities. I completely agree with everything you've shared, and thank you very much for being that example of a leader that you are in El Salvador, and also the example that you are in general for not only for El Salvador, but also other spaces. Because I would like to add myself to the list. So we have a lot of questions. I hope that we'll be able to cover all of the questions that we have in the chat and also in the Q&A. We have some questions here. We have, so we're going to ask the first question from the audience, and it says, have you identified the need to do research on specific topics to reduce those restrictions? What are the areas that may add value to this? Okay, could you please repeat the question? Maybe it's not clear. Let me repeat it for you. Have you identified the need to research on specific topics to reduce these restrictions? That is the first part of the question. The second part is, what are those areas or topics that may add value? Okay. So, on the question of we have identified the needs of research, certainly, as an organization of people living with disabilities, we believe that it is urgent to have research in El Salvador with frameworks that are contextualized to the reality of the population living with disability in our countries. We may have a lot of information, a lot of samples of research that are from other countries. And this is also a call for researchers that are working in the topic. Here, there's definitely space to grow. Us as a foundation, we're making an effort in our experiences and our small knowledge on how climate change affects women living with disability. But if this research would have a more of a technical framework, more disciplinary, from coming from specialists in demographic information, anthropology, etc., all of those topics, and that they think about these areas on how climate change has had an impact in women living with disabilities. For example, statistics, there's a lot we're missing. Until recently with national census, we hope to have more accurate data, more of how many people with disabilities are living in El Salvador. Not having data on people living with disabilities in El Salvador also has a great effect. Not being able to focus the projects on where there's more need. the areas that can be involved, there are researchers working in the mental health, in economic recovery, the economic impact. These few weeks we had rain, and us as people living with disabilities, our organization received many comments from people with disabilities that were affected. They don't have a job, their formal job, and they depend on small businesses going to the streets to sell stuff. And due to the rains, they weren't able to do their economic activity that generates income for one day. So during due to the rain, they weren't able to receive that maybe $1-2 for their daily to cover their daily needs. No one said anything about this in El Salvador about this. No one mentioned in what way this has an impact, in what way we can help in the economic recovery to those that are most vulnerable. Everyone said, yeah, they were going to have days off from there was they're gonna day off for Father's Day or whatever. Great, then that's great for those people that do have a formal job and they do have they do have access to leave to pay time off. But what happens with the people with disability that already their socioeconomical situation is already critical due to the fact that they don't have an employment, due to the situations of crisis and national emergency when everything stops, their situation is even more dire. So that would be important to research, to have research on.
Gracias.
Thank you very much.
Sí, gracias por esa
Thank you
respuesta.
for this answer.
Tenemos muchas preguntas.
Since we
Tenemos
have
5 minutos
many
de cada
questions,
pregunta.
I'm going to just read the next one
Rapidito, porque no quiero que
real
esto
quickly
tome
because
tiempo.
I don't want us to
Mira,
go
dice,
over time.
¿cuál sería
It
una
says, what
estrategia
would
para
be a
las
strategy
barreras
to
limitantes a
approach
las personas
those
con
limiting
discapacidad?
barriers for
¿Cuáles
people, for a person living with disabilities
cómo pueden
that
ser
is
esos
less
retos
visible? What could
cognitivos?
be such as cognitive disability? So the people with disability, we face multiple barriers depending on our disability. For example, in the case of those that are wheelchair users, canes, or walking support devices, our biggest barrier will be not having access to transportation, for example, because it's not accessible, or physical environments. If we talk about the case of people that are deaf, one of their main barriers is not having sign language interpretation that is Salvadorian. But beyond that, the fact that the sign languages and alphabet, the fact that they could not become literate. In the case of people that have a visual disability, not being educated in Braille language, not having technical aid such as canes or walking sticks or a rehab process that allows them to be as independent as possible. And those disabilities that are less visible are those that are the disabilities that at an intellectual psychosocial level, because no one believes that no one sees them with a cane or a wheelchair. They don't have anything wrong with them. Everything's okay. They're normal, and that's all. But people living with intellectual disability and they face multiple barriers. One of these is not having friendly information. These stereotypes from the society also, such as pejorative language. This is a little crazy guy. Yeah, look at him. They don't understand, and also further discrimination. Also, not having training processes that are adapted to their own learning process. So these strategies should bring forth, again, we go back to the beginning, to empower the medical staff, the rehab personnel, teachers. It's not about a special education where these people are set aside. They can be included with reasonable adaptations that can so that it can go at the same rhythm of other people, or maybe on their own pace with reasonable adjustments to accessibility. For example, when we do our workshops, we always assign volunteers, sometimes being people, also people with disability, that provide personalized assistance to people with the intellectual disability. For example, if you need to read a text, their companion this volunteer reads the information to the person and it explains them in a vocabulary that is friendly. Also, if I need to present a topic, to explain it with images and ask them, how do you express it? Because everyone expresses our ideas differently and opinions through drawings, through music, through art. There are many ways in how we can explain a person, a topic. Here we're presenting some images, some pictures where we had our recent workshop on empowering for women with disabilities in the face of climate change. And we have blind women receiving their certificate of having receiving this training. Many of them, in their majority, said that it was the first time that they received a training on climate change. They didn't know even the term, what it meant when we talked about climate change. They didn't know that there was a framework convention of the United Nations, and of which El Salvador has signed it. We see one of our colleagues from the Women's Network and also from the Board of Directors giving a certificate of participation to a blind woman for having participated in the workshops. Maybe we can go to the next picture. And here we have one of the colleagues. This is a person with a Down syndrome, with an intellectual disability, a young person that participated in equal opportunities. It's not about how much this person learned, but specifically what she took as lessons learned that she can make her own in her life, and having had the opportunity to participate. Here we see other colleagues. We are there in a workshop that we have held recently with an international organization called Will for Humanity, where we are reviewing the policies and plan, evacuation and early alert plans in 5 municipalities of intervention in El Salvador. So all of the people living with disabilities that participated gave their comments or feedback on how these policies, these protocols, municipal protocols can be further inclusive for their communities. Here we have people with intellectual disabilities and other types of disability. So these are all of those things that need to be taken into consideration when it comes to bringing forth a message to a population. We need to think of what are those reasonable adjustments? How can I explain it so the instructions are clear? And I'm really happy to see that the colleagues have done all of this effort. Now, could you please give us some examples of countries or media outlets that may exist where there is a culture of diffusion that is related to the realities and experiences of people living with disability? All right, so some countries, it's curious actually. Recently, we were looking into countries, I don't remember if it was Sweden, those countries in Europe, Nordic countries, where the news stations, when they're giving the news, they have the sign language interpretation frame. Here in El Salvador, we only have one media outlet that provides their news with sign language interpretation. So the interpretation is, let's say, I am the newscaster and news anchor. And here we have a small frame of the interpreters. It's barely visible, so you need to get close to the screen to be able to see the signs. And let's imagine that the deaf person, besides of them being deaf, they may have issues with their visibility, or maybe they use glasses. It becomes more difficult to see the little frame. So we noticed that in the countries in Europe, it's the other way around. The frame of the interpreter is the one that is larger, and the frame of the news anchor is one that is smaller. So it is focused in that communication to responding to the requirement of accessibility of the deaf person, because the rest of the population is listening. They can see it. So there are other examples such as this one of early alert, for example. For example, I've been I've had the opportunity to study, to be in the United States, and there also being able to see the alerts for people, for deaf individuals. Maybe here there's an alert the person that can hear may be able to listen to it, but someone that is deaf, then we have a light system. Each color that means this or the other. Also, signage, or we have the arrows or symbols that we see, that those arrows indicate to where is the evacuation center, for example, or the meeting spot. All of those that are only visual and not colorful, but also that they may have braille braille signals. So for the blind individuals can also be informed that this is the access route, this is the route I need to take,
Sí, sí.
this isn't the route I should take.
Muy interesante.
These are very interesting examples.
Gracias.
Yes, thank you very
La
much.
siguiente pregunta,
Next
sí, ya
question
se nos está
is,
terminando el
I
tiempo,
know that
entonces
we're almost out of time,
procedo
so I'm
rápido.
trying to go a little bit
¿Cómo
faster.
podemos hacer valer
How
nuestros
can
derechos
we
cuando
ensure
estamos
the rights of
en
people that live
situaciones
with
de riesgo?
disabilities in
Si no
situations
nos
of
toman
risk
en cuenta
if we
muchas
are not
veces
taken into
y no
consideration
escuchamos
oftentimes
las
because there
sanciones
aren't
para el
sanctions
que no haga
for
valer
those that
estos
don't
derechos en estas
respect our
situaciones.
rights in these situations? That is a really complex question. Not because we don't know how to answer it, but because this is a reality that is affecting us in El Salvador. We have conventions, we have a special law of inclusion of a person living with disability. Sadly, this law doesn't have a regulation yet, and it doesn't have a budget allocated to it so that this law can be enforced and it can be fully enforced. In that regard, any violation or vulneration, the rights of the people with disability are left in order to respect the law, we have our hands tied to not being able to act. However, the fact that there isn't a regulation or a budget allocated for said law, it doesn't mean either that nothing should be done about it. We do have the prosecutor's office for defense of human rights. We have the prosecutors, and also we have the convention on the rights of people living with disability and the other inter-American convention, where if a case isn't heard by the local authorities or national authorities, this can be this demand or this report has been brought forth at an international level. What is the key here? If a person living with disability, if their family members aren't empowered and said rights, and what to do in the case that their rights are violated against, the vicious cycle of respect to the rights will continue to be repeated. So the key is empowerment. Being aware that I, as a person with disability, with a family member, a mother, a father that is a caretaker of a person living with disabilities, I have a responsibility with myself to become empowered of my rights and also empowering other individuals.
Gracias, Jenny, gracias.
Thank you very much. We are basically out of time here, and would like to first of all to thank you for all of the time that you've provided us to explain the work that you do and you've been doing. But sadly, we need to close the questions here, and also apologize because for those questions that we weren't able to cover. Again, we would like to thank you for all your comments on such an important topic that you helped us cover, and the participation also of the audience. We thank you. Before we finish, I would like to invite you to the next session of the series of webinars that are focused on, will be focused on children. This session will take place on August 14th. It will be sharing information via chat so that you'll be able to register. Again, thank you very much, Jenny. Thank you to Alianza Americas for this great opportunity. I would also like to thank all the people that registered, that were here giving likes and hearts. I think that we've been covering a topic where the person that is listening may have felt identified, and that's what's beautiful of us, ourselves being us as people with disabilities, those who cover these topics from our experiences. So a warm hello to my colleagues from Fundación SEA, organizations that live with people who live with disabilities. A big hello to those organizations and entities that provide services in our countries and that make the voice heard, and with whom we have been doing some projects together. Let's continue moving forward, and great congratulations for this series of webinars that certainly are empowering and bringing culture to our communities. Thank you also very much to those that joined us from other countries. Thank you very much. Thank you, Jenny. We will add your information for those who would like to continue in contact with you. So